Good afternoon, everyone. This is County Executive Pat Ryan here with Dr. Corey. Dr. Corey, thank you for joining today on behalf of both BOCES, but also all the school superintendents in the county. Really appreciate you being here.
Thank you. Thanks for having me.
We're going to talk. In a minute about schools and a significant announcement in a positive way. We think anyway. In terms of moving forward with schools. But before I do that, I am going to just give our regular update on how we're doing with COVID in terms of the infection rate as well as our vaccination progress. Overall, at the high level, good news on both of those fronts as we continue to make our way into the spring. And I will say today finally feels like
The spring.
spring is in the air.
Yep,
Maybe some good news, some good weather for sure. So.
Yes.
All right, so I'm going to go quickly through the numbers. Right now, total cases in the county cumulatively 11,488. We're coming up on almost 293,000 tests completed in the last now over a year, which is kind of remarkable. 9,659 recovered, and thankfully the fatality rate has really started to slow down. But we still have had 236 of our Ulster County residents lost to COVID in the last year. Hospitalizations remain steady, almost actually to the number. We're once again at 9 hospitalized in Ulster County for COVID-19 right now, 0 of them in the ICU or intubated, thankfully, on a ventilator. That number is still higher than of course we would like, but you can see on the graph a clear drop from the peak that we were experiencing through the holidays into the beginning part of 2021, thankfully. The active case count, this is still a point that we're looking at carefully, still remains higher than we'd like at 1,593 active cases. You can see once again on the graph a little bit of a level off plateau for about the last week or so. We were really bringing the numbers down, and then we've held on that plateau higher than we'd like. We have more work to do to get that number down, and that's going to require each of us to do our part as we've been doing for the last year. We'll talk more about that in a moment. The new positive test rate, again, we've made significant progress here, as you can see on the graph, but we still have some work to do here as well. In the last 48 hours, we've experienced just over a 5% new infection rate, 5.3% of those tested. So we've tested 2,748 and had 146 new positive. That's a 5.3% new infection rate over the last 48-hour period. Looking at the long-term cumulative projections, you can see where we're at there. We have started to flatten out, but still steeper than we'd like. And again, if we're going to come into the spring in a good place and do all the things that we want and need to do for our economy, for our schools, and for everything else, we do have to continue to stay vigilant. We have to continue to keep our guard up at the individual level, at the family level, at the sort of workplace level to keep this in check. Hospital capacity going forward, we're in very good shape here. Thankfully, 9 hospitalized and more than sufficient for near, medium, long-term need in terms of hospital and treatment capacity. Once again, you've been with me before saying this, Dr. Corey, from the beginning.
About a year ago.
But the message hasn't changed. And I think, as a segue to what we're going to talk about in a minute, the schools, when you have been in person, have done a remarkable job showing how effectively the mitigation works in terms of masks, social distancing, washing hands.
Yes.
The infection rates when kids were back in school were extremely low because we were just talking, as you were saying, everyone took it seriously and followed the rules.
Yes, that's right.
So if the whole county could emulate our young people and our educators,
Yeah.
then we'd be in good shape. And again, we'll talk more about that in just 1 minute. The last update I want to give before we talk about schools is on our vaccine progress and how we're doing there. So we started the week with some news that we were getting less vaccine supply than we had gotten the week prior. Last week, we got over 7,000 doses, much of which was a bit of a one-time supply to correct for some of the lower dosages we had gotten in weeks prior. And this week, we were a little disappointed to hear that we got less. However, yesterday we learned we got another 1,170 doses of vaccine. So now, for the week, the cumulative total for Ulster County, we've been allocated 4,310 vaccines. So throughout the week, we've been adding to this total, which is good. As I've continued to advocate to the state that anytime there's extra vaccine to be had, we desperately need it and want it and are ready to distribute it here in Ulster County. So our preparation and advocacy has been rewarded again with additional allocation. That's another 1,170 from what was announced just yesterday. So each day we're making some headway here. We do anticipate this will be the total for the week, 4,310. And again, as a reminder, that's still significantly more than we'd been getting through January and February. So I'm very optimistic about the progress we're making in picking up the vaccine supply. Obviously, we need more, and we're pushing to get that. The current vaccination locations across the county remain essentially the same. Here's the list. Our county pod sites for this week will be at Kingston High School, at the Kate Walton Fieldhouse, as well as Ellenville High School. I do want to thank SUNY Ulster for hosting us last week. That was a very successful pod as well. And I again want to thank Kingston and Ellenville High Schools for opening up their space for the community to do this critical work. Other partners that are vaccinating this week also on the list. You can see Institute for Family Health in Ellenville, Rite Aid in Kingston, and then 4 different Walgreens locations throughout the county, each of them getting either 100 or 200 doses, so relatively small amounts, but that does help with our geographic dispersion of vaccine. The other very big and very positive news that we got this week was the state did finally answer our calls. Myself, our state legislative leaders, our county legislature, all calling for a state-run vaccination site here in Ulster County. I was very pleased that on Monday, the governor did announce that we are one of 10 additional sites that will get stood up in the next, we hope, 1 to 2 weeks. That site, which will be in addition to our county-run sites, that site will be at the Ulster County Fairgrounds, right in the town of New Paltz, which we were very happy and willing to open up that county asset to the state to stand up that state-run site. In terms of what that will mean for residents, we've gotten a lot of questions about that. Once that state-run site is up and running, folks will be able to book appointments there through the New York State vaccination page, the Am I Eligible page. If you go on there right now, that won't be an option because the site is not yet activated. So as soon as that is an option, we will let you know. We are also going to share our county list of those who have pre-registered with the county. We'll also be sharing that with the state to help smooth that crossover as well. To be clear, we will continue to operate our county pod sites, and we'll also add on the state-run site. So that really helps serve the southern part of Ulster County, where I happen to live. I could almost walk actually to the fairgrounds. So for those in our southern part of the county, southeast and southwest, we have heard you, I've heard you, and really pleased that the state is going to put this site up. I really want to thank them. Our teams have been at the site at the fairgrounds yesterday and today, coordinating and preparing to open that up. And as soon as we know when, we'll let you know. Finally, for anybody out there that has not signed up yet, I still strongly encourage you to sign up for our pre-registration list for vaccine. You can go to vaccinateulster.com if you're able to access the web, or you can call our Recovery Service Center phone. That is 845-443-8888. As we get more and more supply, we have more and more appointments. For the first time last week, we actually were able to go beyond our pre-registration list and start offering appointments to other eligible folks via social media. So also watch our social media sites For those that have called the Office for the Aging or the Recovery Service Center, look out for that phone call, look out for that email, because as we get appointments each day, we will be sending those links out to book your appointments. So very good news on the vaccine front. And to sum up, I apologize, I had one more slide before we get to this, Dr. Corey. Lots happening here today. To sum up where we are with vaccinations, we've crossed a very significant milestone in the last week. We are now well over 20% of Ulster County residents that have received at least their first dose of vaccine. Over 40,000 residents now, 40,444 to be exact, have received their first dose of the vaccine. That is a number that felt unattainable just a few weeks ago. We have a lot more to do, but that is very encouraging. The pace is really picking up. And I think we're now down probably, as long as this rate of supply continues, to a matter of months before we can get everybody vaccinated, especially with the state site coming on. So very good news. Spread the word to those that are looking for appointments to please use that pre-registration list at vaccinateulster.com. So with all that said, turn to, I think, one of the most significant announcements we've made really in the pandemic, in my opinion, something that'll be very important and I think significant for lots of families, kids, teachers, educators, and staff. And I'm going to hand it to Dr. Corey in a minute, but after a lot of work with all of our district leaders across the county, a lot of deliberation, thought, care, and planning, we feel comfortable that we now have a clear path for schools to open for in-person learning safely and responsibly in Ulster County, and we think we can do that in a matter of, it won't be tomorrow, but in a matter of weeks.
Yeah.
And so we'll talk more about that here over the next few minutes. Our Health Commissioner, Dr. Smith, and our County Department of Health today are releasing updated guidance, a multi-page memo that will really facilitate school reopening for in-person learning. And I think one of the key things, probably the key thing that has changed to allow this to happen is that from day one, Ulster County, through our vaccination process, we have prioritized, as soon as 1B was eligible, we prioritized vaccinating our educators and our school district staff for this reason, to allow for this reopening. We now have over 95% of all educators and staff who want to be vaccinated have been vaccinated in Ulster County. That's something I'm really proud of, that I think collectively our teams deserve some recognition and credit for. To be clear, though, individual districts still will make this decision. They'll work with their parents and their staffs to work this through. But we now feel, with the right safety precautions in place, that this can be done and frankly should be done for the greater public good and public health. So Dr. Corey, thank you again for joining us. Thanks for sitting through the other parts of the update here.
Okay.
And would love to hear from you in terms of your thoughts on this.
Yeah, thanks. I know from speaking with all of the superintendents on a regular basis, everybody wants the kids back in school as soon as possible, as long as we can do so safely and adhering to the guidance that comes out of the state and the county. I think the significant part that is in the guidance that's being issued today is the ability to use a smaller distance for social distancing with the proper mitigation efforts, the placement of polycarbonate screens at desk levels, which can help to mitigate the transmission of any kind of virus that might be existing. We will still, and I can speak for all of the county superintendents, we are still adhering to only doing so when we can assure the safety and well-being of our staff and our students. The efforts that the county has gone to prioritize K-12 staff to get vaccinations is unheard of in the state. I don't know of any other county that really took that stand early on, and that's gone a long way to make our staffs feel more comfortable with being in a larger populate or congregate setting with all of the students. There's still a lot of work to be done. I know every school district has been talking and thinking about the issues of what would we do if the distancing was closer. Many of them have sent out surveys. Many of them are about to send out surveys. We have about 20% of the students in the county whose parents have chosen to be remote only. We have to know how many of those parents will choose to send their kids to in-person once, in fact, we go to a longer in-person schedule. It could be 4 days a week in person, 1 day a week still remote, because if there's a sizable number of students who continue to need remote-only instruction, we have to provide the time for our staff to provide that instruction. And so there's a lot of factors that have to be considered, but I'm comfortable, I'll be meeting with the superintendents early tomorrow morning to talk about where are we headed, how are we collectively going to make these decisions moving forward. But I know fundamentally, all of the superintendents, to a person, of the 9 school districts in the county, all want their kids back in school and want them to be back in school in a safe and healthy environment. Our teaching staffs are ready, and we're ramping up, ready to greet those kids back on a more regular basis than they have been since day one.
And I'm recalling, so today is March 11th of 2021. On March 13th of 2020,
Yes.
I think we did a similar
Yes.
event here, where we were actually one of the first counties in the state to proactively close our schools ahead of the state.
That's right.
Based on the science, based on the health expertise and all the data. And I think once again, after a lot of thought and planning, we feel, based on the science and the health expertise, that we can do this safely, and looking at all of the other impacts on our young people and our educators,
Yep.
that the net public good to do this is huge, and I'll talk about this in a moment, there are a set of mitigation strategies
Yes.
that we can implement that we know are already effective because we've used them before, as we talked about, and that I just know anecdotally, talking to our friends that are parents, this is I think everyone feels sort of the right thing to do, as long as we can do it carefully and safely, which we absolutely feel we can. Dr. Corey, can you talk a little bit about timeline? I know if I'm a parent or a teacher hearing this, what's going to change? How quickly is it going to change? My sense is sort of the soonest we'd see this implemented would be probably after spring break in
Yes.
April.
Yes. Yeah. I know all of the school districts are collecting data from their parent communities, developing plans as to how to shift from or pivot from a hybrid schedule to a more in-person schedule. Fortunately, we have a spring break coming up in the county the last week in March. And I would suspect it's going to be more towards the second half of the month of April. And that's making a bunch of assumptions. It's assuming that the survey data that districts are collecting from their parents, in fact, points to the ability for them to greet socially distance at a smaller level a large number of students. It also depends on the prompt delivery. All of them have basically, or many of them have basically ordered the necessary protective devices. And if those get delivered on time, they have to be set up. They have to be established in each of the classrooms. And so that's going to take some time. So I'd be looking at the midpoint of April or later. But each district will be different. Even with PPE or some districts had things earlier, some districts had things later. And so, it's not going to be a single date across the county. But I do know that every single superintendent will be communicating with their parent community, probably certainly by next Monday at the latest, and probably even sooner than that, about what's going on, the change in the guidance documents, as well as their plans moving forward, probably in a very skeleton format initially, but then as they lock things down, it'll be a more detailed plan so parents can plan and react.
Great. And we've been referencing this new guidance memo from our health department, and this may have already been up on the screen. If so, I apologize. We will be posting It's about a 2.5 page document prepared by our health department under the guidance of Dr. Smith in close coordination with all the school superintendents. We've had extensive conversations about this really for months now,
Yes.
leading to this moment, and working together on a daily basis, really, our teams. A lot of this, I would encourage folks to actually read that memo. A lot of the introduction and background really lays out the other impacts that our children and our families and our
Yes.
community have experienced in a detrimental way due to the lack of in-person learning, which really did factor into the overall sort of decision-making process here.
Yeah, there've been many challenges. We're all worried about the social and emotional health of all of our children, not being able to see their friends and classmates on a regular basis, and also not being able to see their teachers
Right.
on a regular in-person basis. That has a negative effect on children. And I know personally that when we were closed for 2 weeks or pivoted to remote learning pre the Christmas holiday, when those students came back into school, they were hugging each other in a kind of socially distanced way with fist bumps and elbow bumps and so on. They were so thrilled to be back in school. And I think, universally, that's something that we all want to see for all of our kids as soon as we can do so safely and responsibly. And this is going to go a long way to make that happen.
And in the coming weeks, to the timeline that Dr. Corey talked about, there will be intensive work and effort by all the districts and leadership and staff, as well as our health team, to make sure that there are a series of precautions and measures that are in place that we're ready for. I'm going to put up a list of some of the key mitigation strategies that are outlined in that memo that we talked about. Many of these are sort of things you would assume in terms of mask wearing, distancing. As Dr. Corey mentioned, we did give, the health department feels now that if absolutely necessary, the distance for student to student can go down to 3 feet.
Right.
It had been 6.
Yes.
The distance between student and teacher must still be 6 feet.
Yep.
But given now the vaccination level where it is of staff, given the infection rate where it is, and given the other risks we talked about, that was one of the key recommendations, as Dr. Corey mentioned. All the cleaning and hand washing protocols, we will continue to provide as a county testing and contact tracing support as we have, so that as we monitor this and look at the data, we can have a good, accurate, data-driven picture of how things are going. That will continue to happen and actually become more and more important, of course. So our county health department will, and our team and myself will be here to support that and ensure that that's happening, so that we can all feel comfortable that as we take these small steps, and it will be, I think, in sort of incremental, careful thing, we can always look at the data, see how we're doing, adjust. But in my mind, it's very clear that the imperative now is to start this work, to begin that movement,
Yep.
to get back in-person learning.
And I think to your point of we still have to remain vigilant. If a parent has a child who's not feeling well, don't send them to school. Contact the school nurse. They'll tell you what the next steps are in terms of, contacting your private health provider, or because we've done a good job because we've stuck to those rules. We potentially are going to have more children in school on a more regular basis as we move forward with this plan, which increases the probability or possibility that there could be an infection or a positive case in a classroom, which would then mean we would have to pivot to remote for that classroom, or to, so all of the rule, we can do this if everybody is on the same page. Right. In terms of, the mitigation. We can do our part, and the parents have been great. I mean, by and large, our parents have really helped to follow the protocols. And if they continue to do that, we should be able to end the school year under this schedule with no hiccups.
That would be pretty awesome.
Yeah,
I think
absolutely.
everybody feels that way. And again, just to really show how much thought and detail is in this memo, I'm not going to read through this list, but want to put up an additional, and this isn't even all of the different pieces We've talked through, but I just want everyone to understand there's an in-depth plan with a set of protocol here that's based on federal guidance, state guidance, and our own county health department to really ensure we're doing this right and carefully. So we will continue to work that as we go. The last thing that I think is important as a caveat, too, that I forgot to mention, and correct me if I'm wrong, Dr. Corey, but for parents especially, for sure, this school year, that just are not comfortable with coming back, they will absolutely have that right to continue with remote learning, correct?
That's absolutely true. The governor mandated that at the beginning of this school year, and all of the school districts have a population of parents and students who've decided that they want to keep their children home. Many parents have shared their reasons. They don't have to with me. Usually it's an elderly parent or a grandparent at home that they didn't want to expose to the potential risk. That will continue through the rest of this school year.
Right.
So, and I think that's what's being surveyed by our superintendents as they reach out to their communities, because we have to know how many parents who have their children remote only are going to want to send their kids back to school on a more regular basis.
And I think for each person, that calculus will change, because now that, again, to me, the game changer here is vaccination.
Yeah.
We're approaching 23% of the county vaccinated, particularly our seniors and the most vulnerable, which we've prioritized from the beginning.
Yep.
And of course, our teachers now and educators and staff members being well above 95%. So that is the game changer to me. And I hope that that gives everyone that reassurance. And in the places around the world and even here in the U.S., as we've seen, for example, our senior facilities all now vaccinated with first and second doses, the infection rates are just dropping to near zero, hospitalization zero, fatalities zero. So we're seeing all the evidence now that the vaccine, as promised and as the science showed, is working. And so the timing now really makes sense to us, and I think to many folks that we're talking to. So, this is a first step. It's a significant first step. There's a lot more work to do.
Yes.
What else should we be thinking about? Should folks be thinking about, Dr. Corey, as we start this next step?
Well, I think everybody should be paying attention to communications that will be coming out of their school district offices probably in the next 72 hours, certainly by Monday, maybe sooner than that, maybe over the weekend. It could be a little later depending on the complexity of a particular district. I suspect some of the larger districts have a little bit more planning to do, but they all have been thinking about this for the last several weeks as we started to kind of read the guidance that was happening across the country as well as around the state. But certainly be on the lookout with however your district communicates, more likely by email or postings on their website or social media. I expect something would come out over the next 72 hours from their districts, at least alerting the parents to the change in practice that's forthcoming, and that's being announced today, as well as their planning and their timeline for their particular district. Like I said before, every district is a little bit different in terms of the complexity of the planning, and so the plans will not be exactly the same in all 9 districts. They'll be a little bit different. So, if I have a child in Ellenville, it's not going to necessarily be the same plan as a child in Saugerties. But every district is doing careful planning to make sure that they can maximize the in-person time for children in their district. And I'm excited about that happening, and I'm sure that we can do it safely following the guidance.
Good. Well, I am too. And as we wrap up, Dr. Corey, I want to thank you, each of the superintendents. I think I now know the voices of all 9 superintendents in a way that I didn't, a year ago. We've I think one of the many great examples of our leaders in different avenues of the community stepping up. You all have been remarkable. Our teachers and staff have done almost the impossible this last year. And I think from my conversations with many leaders from our teachers groups and others, in large part, they're also encouraged by this news and feel that their students really have been missing out being virtual, and feel that urge to get this right, but to do it. And so we'll also continue that dialogue with our teachers to make sure they have, of course, the vaccines, which we're essentially complete with testing and contact tracing and PPE and any of those needs.
Absolutely.
We stand ready. But I'm sure it's often a thankless job to make these hard calls. But on behalf of all the residents, the 180,000 of the county, thank you, Dr. Corey. Your personal leadership, to be able to count on you to guide us through this, all the superintendents. I hope everybody understands the great work and kind of nonstop, tireless work that's been going on from your team. So thank you.
Thank you for saying that. And just really publicly, the 9 superintendents have been outstanding. You know, those are 24/7 jobs, as yours is as well. And your team has been great. You know, it's not uncommon for us to be text messaging and calling and emailing on Saturdays, Sundays, at 10 o'clock at night during the week. The job doesn't stop, and everybody wants the right thing for the children of this county. And so we're all on the same page. It's great when everybody works together and pulls on the oars in the same direction.
That's what we're going for.
Yep, absolutely.
Well, thanks, Dr. Corey. Thank you to all of our frontline workers, as we always do. Special shout out, since we're talking about educators and teachers, to all of our educators and teachers. Many of them that have gotten, many have gotten their first and second dose. There are some still waiting for their second dose, so that's also part of the reason why we're looking a few weeks out, not immediate, to make sure second doses have been received and had time to set in, which is not the proper technical term, but I think everybody knows what I mean.
Yeah, the
there.
last group is today, getting their first dose, and so they'll get their second dose in a month, and then 2 weeks after that, they'll be fine. But many have already had second dose and are into that no quarantine period.
Yep, it's a good feeling, and to see the CDC guidance that grandparents can hug their grandkids. I know for my parents who just got their first doses, that's a really big deal that hasn't happened in a year plus. So I'm very optimistic. We have a lot more work ahead, but I'm very optimistic. Thanks everybody for sticking together. We got more to go through, but again, if we continue to stick together through this, think not just of ourselves, but of everybody and how to have a net positive for the community, I think we'll get through this and come into the spring better for it, honestly, and tougher and stronger for it. So thanks for tuning in. Our next update will be Tuesday at 3 p.m. In the interim, if you have any needs or questions about vaccines or anything COVID-related or otherwise, you can call our Recovery Service Center. We'll put that number up. Again, vaccinateulster.com if you need to get on our pre-registration list. And we are going to keep pushing on all these fronts. In the meantime, stay safe and healthy and resilient, and we'll see you in a few days.